Get ready for a captivating conversation with Shihab Makaniyil, the mastermind behind ShopDoc, a groundbreaking digital healthcare platform taking Kerala by storm. As its founder and CEO, Shihab has steered ShopDoc towards becoming a game changer in healthcare delivery, especially in mental health, women's empowerment, and community-based care. Today, we embark on a journey into the world of ShopDoc, unlocking its pioneering initiatives and uncovering the secrets behind its phenomenal success. Prepare to hear Shihab unveiling the challenges, guiding lights, and ambitious vision for this impactful healthcare venture that's changing lives, one click at a time. So Shihab, we are truly honored to have you here with us. Welcome aboard.
Thank you. Thank you, Luis, for having me.
Okay, so tell us before ShopDoc, what path paved the way? We'd love to hear about your journey and what sparked your passion for digital healthcare.
Well, ShopDoc was actually founded not in India. It was in the idea was conceived and the initial product was developed and tested in Australia. So I was in Australia. I was working for a company called Exotica, which is the largest manufacturer of prescription lenses, eyewear, and eye care services in the world. So it's an Italian company. I was working for that company in Australia, in Sydney. And then at the time, I knew I was into, the patient care for eye care. Then I realized a lot of elderly people had to go all the way to the suburb towns and cities to get their eye test done twice in a year. So why can't we? Then I thought, why can't we have a mobile clinic, a clinic on the van for eye, ear, and dental care services to be available at the doorstep of these elderly family members. So that's when I had an Australian partner, a woman, and then we created a company. We formed a company called Mobile Eye, Ear, and Dental Care.
Awesome.
That was the actual idea when we conceived in Australia. We started out in Australia. So, and then I had to come back to Kerala for various reasons. And then I wanted to replicate the same company and the same product, and we incorporated again as Mobile Care in Kerala. And we built a digital platform for mobile eye, ear, and dental care, for eye, ear, and dental care services. Okay. And that is the time, just few months after COVID struck. And that is when all over the world, particularly India, legalized telemedicine services. So instead of sticking to 3 specialties, ear and dental care, and we thought of this bringing all multiple specialties together and start serving the patients. And at the time, everybody was in their houses. Lockdown happened.
Understood. Yeah.
And that was the time when the telemedicine and the teleconsultation, the need of teleconsultation. And instead of Mobile Care, we rebranded the platform name as ShopDoc. So the parent company is still Mobile Care. So that is how the ShopDoc was born. Before that, I had worked predominantly in eye care and vision care for about 15 years across the Gulf, Europe, and a few years in Australia. Though it was dealing with one of the segments in the healthcare, wider healthcare, eye care, I was not really into anything sort of healthcare, except this, I didn't know anything much about healthcare. I'm not a medical doctor. I'm not any medical practitioner or licensed practitioner. And I was more into the fashion elements, the eyewear. I had consulting firm, which is called Makaniyil Global Strategies. We were helping luxury companies to do different marketing and management services in different parts of the world, and we were kind of supporting that kind of consulting work. And before that, like I said, I worked in eye care and vision care, and I was also involved in healthcare non-profit in my native. So going to specifically to eye, ear, and dental care, then COVID and other aspects and the whole transformation afterwards when it comes to healthcare and understanding the problem wider. These things led to me founding of ShopDoc and staying with it to the next 4.5 years, almost 5 years now.
Yes, so that's fantastic. So you had a vision by then, that COVID hit that time.
Yeah, when we founded, we didn't have a clear vision.
Okay.
To be honest.
Okay.
So the vision itself evolved over the time.
Okay, understood.
Over a period of time, and we learned a lot of things in the process. And now, there is something. I was working towards a purpose, which was helping people with their physical, mental, and emotional health.
I see. Okay.
And what drove me then is I thought if we could deliver quality healthcare services at mass,
Okay.
we could make a huge societal impact. So that is why we started building this digital platform.
Okay.
So which enabled us to reach out to as many number of people as possible in a shorter period of time.
Fantastic.
What if I had started a small clinic which was serving my village? It could only help the people
Within that
the 10-kilometer radius, 20,000 people max. Instead, I choose, I can say,
we want a wider
a platform, and we onboarded nearly 200 hospitals and clinics, 3,000 doctors, and started serving patients.
Okay.
Not just in India, in Kerala, not limited, the people from different parts of the world, particularly the diaspora, they start using our services.
Wonderful.
So, yeah, that is the journey.
So, what was the core idea? How do you see it transforming healthcare in Kerala, empowering communities, and making a lasting impact?
Okay, well, for the past 4 or 5 years, I was not just building a brand or business or platform, a product.
Okay.
I've been learning a lot of things, particularly how health of a family and how it is affecting their peace, their progress, not just limited to that family, then a wider society, and what are the problems everyone faces. And the alarming thing is when we look at Kerala, even though we have the most sophisticated infrastructure when it comes to public health, well-educated people, all the resources available, yet the number of patients and people who are suffering from lifestyle diseases, chronic illnesses, are increasing exponentially. And now we are refocusing, as a company, ShopDoc, we are refocusing to address this massive issue, which is, to prevent lifestyle diseases, and to the best of our ability, we could also reverse certain diseases. So now our focus is more on the lifestyle disease prevention and the reversal. So we are investing more on that.
Okay.
Our resources are being allocated more towards that particular mission. Okay. So the kind of impact, if you look at every household, how many people in a family are suffering from either diabetes, overweight, hypertension, cardiovascular diseases. the list of lifestyle diseases. So if we can improve on that non-communicable diseases, the lifestyle diseases, we can help every family in the state, every family in the country. So that is the impact we are now looking at.
Okay.
So
Fantastic.
instead of curative medicine, we are focusing more on the preventive side.
Wonderful.
And the way in which we are going to execute our certain programs, our philosophy is more of less medication as possible. Intervene in their lifestyle and help them modify, make that changes, help them transform and thrive. So this is our new mantra. We are working, really hard to achieve, that. I mean, we are going grassroots level, hyper locally, community level. We are going to engage with the. We have a plan to reach out to almost 948 villages and about 68 or 60 municipal towns. We want to reach all across Kerala. Our focus is Kerala. So we are not going to expand beyond Kerala the next few years. Yes, we have presence in the Gulf. So like we say, like UAE or Dubai or Gulf as a whole, we say the 15th district of Kerala. So
exactly.
In that sense, as a business, we are focusing Kerala, and the Kerala is living across the world, and particularly in the Gulf.
Awesome. Fantastic. So they always say precaution is better than cure, right?
Yes.
So you're creating, people also should be aware that these, lifestyle diseases are formed through certain situations. So it's like a training tool that you're giving them.
Exactly. And I must tell you that it's not just about lack of awareness. Nowadays, the social media, creating a lot of waves and a lot of information is available. People are much more aware than before. But still, if you look at the majority of the people who are suffering from some sort of lifestyle diseases, they already know. Okay. They already know how they got and everything, But there is no mechanism in terms of enforcing and making sure they are following the right thing. They don't have that environment created around them.
Understood, yes.
So, that is what we are trying to sort of tackle.
Yeah.
Society
awareness.
So, awareness, education, and implementation, the coaching, and we are going to create communities in which we create that environment in which the people, can lead a life in which they don't have to rely more on
medication.
Things which can detrimental to their, health. So, yeah.
Wonderful. So users are the pulse of innovation, right? What's the most impactful feedback you've received, and how has it shaped ShopDoc's community approach?
Okay. So, as a company, we never spent a single dollar on advertisement yet.
Wonderful.
Okay. We've been in the business almost 5 years. We never spent a single dollar for any advertisement.
That's fantastic.
But we have a significant investment being made on the marketing side. Where this money gone without advertising, we spend on creating communities, building communities, conducting workshops and seminars, community levels. And the thing is, I can talk about the different communities we built along the way. And one particular community we created, which had much more impact than the whole other ShopDoc, other communities combined, is mental health.
Mental health.
Yeah. So we started off delivering mental health support services during the second wave of COVID, when that lockdown happened. And right after, what we did was we reached out to the Gen Z populations, those who are in school, high school and colleges, colleges, and we conducted a lot of webinars. And right after, once the the lockdown restriction lifted, we conducted physical events, and the community called You Okay. Instead of Are You Okay? So we shorten it and we call our community You Okay.
You Okay.
And which served more than 10,000 people in terms of mental health support. See, we need to look at mental health is as equally important as the physical health, which was neglected for a long period of time because people didn't have much awareness. We didn't know anything, there was a social stigma around it. And then when we started reaching out and helping the vulnerable, especially women and children, when it comes to mental health, we got a lot of feedback, how the family changed after people taking therapies, taking counseling sessions, how the students improved in their education, how married couple reconciled and they got back together, the issues have been resolved, how their productivity at workplace improved, how people evolved, how they're, once, after taking the therapy and things like that, how they are able to process their emotions, how to lead a better life.
Okay, that's
these are beyond words. So we got a lot of feedback from such clients, and these are not when I say mental health, how much impact it created. So when someone came to us with a broken leg and we fix it, it is tangible, it is easily visible.
Exactly, yes.
But when we fix a breadwinner's mental health, or
something else,
an important, crucial person in the family, their mental health, and what impact the whole family members
receives,
it is remarkable. So like that, we have helped hundreds of families. Thousands of people and hundreds of families in the mental health. That community level of engagement is the most impactful communities we've created, and the feedback we received. I must say that.
Building bridges, expanding horizons. What's your strategy for growth? Share your vision for adding services, reaching new users, and ensuring long-time sustainability.
Okay. So, instead of saying a new user, typically startups call their customers and users. We don't want to call user.
Okay.
Because we are dealing with people health. We are in the business of delivering care, compassion. So we are purely a healthcare company. We are not a technology company. We are a healthcare company, 100% healthcare company. We are delivering healthcare, compassion, care, everything. In order to deliver in mass, we are employing technology. We are tooling. We are using different digital tools to enhance the quality of our services and also the reach. Okay. Coming back to the question, when you say expanding horizon, the thing is, like I earlier mentioned, our focus now, strictly Kerala, and the Kerala is living across the Gulf, or particularly Gulf and other parts of the world. So we still have a lot of problems when it comes to healthcare locally. Okay, so not everything is well addressed. Government can't do everything. So as a private company, we have our responsibility, and as a socially concerned, and I would call myself as a social entrepreneur in some sense. So we want to stick here, and we want to prevent we want to prevent diseases, and we want to help as many people as possible.
Okay.
So by delivering the kind of services we want to give, we want to deliver, and making sure there is a definite outcome, the patient outcome.
Okay.
And that itself is a great testimony and which will give us very organic growth, sustainable growth, which is something, the country, the world needs. Okay,
It's
so
like a natural understanding.
natural
I should say,
understanding, yes.
Connect that you.
So people are facing a lot of problems in their day-to-day life. When it comes to health, it's a mission critical.
Understood.
Yeah.
Yeah.
So when we have a service, a product that can solve their fundamental problem in healthcare, which itself guarantees the long-term sustainability of the product, the service, the brand.
Very true. Yeah.
Yeah. And again, I would say we don't want to expand all across the world. We know that is not, Kerala, and the Kerala is living across the Gulf, particularly in the Gulf and other parts of the world. And beyond Kerala, will expand in different parts of India. Because which itself a huge, when you talk about it's a business, a commercial entity, so it's a market, it's a huge market in
Exactly.
India.
Yes. Yeah. That's true. So digital trust is paramount. How does ShopDoc safeguard patient data in this era of cyber risks?
Yeah.
We can hear a lot of situations that people go across. They fall into some dealings and things like that, which is not at all in their book.
Yeah. See, not just in digital healthcare, the healthcare industry, if you look at the healthcare industry as a whole, there's a huge monumental level of trust deficit. Okay. So recently I did run a poll on LinkedIn and personally, on my personal account and also on Instagram, asking people to poll, do you really trust doctors? Do you think pharmaceutical companies are bribing the doctors and paying unethically to the doctors in terms of, in exchange of prescribing the medications? Almost 90% of the people, or 92% of the people don't trust doctors. Which implies that they don't trust the existing status quo healthcare systems.
Yes.
So look at the healthcare industry as a whole. There is a huge amount of trust deficit. And healthcare is the most heavily regulated industry. And we know that any business that operates online, every business now operates on online. There is a risk of, data being misused or stolen, that the privacy is no longer. So as a company, we are complying our standards. We are auditing our processes. We are still a new company. We are a small company.
Understood. Yeah.
Okay. We are still learning, but we are ensuring we are following all the compliances. And we have, as part of our values and principles, we are not going to use our patient data for something else.
Understood.
We will use our patient's data in such a way that we can deliver better care and services. We need those data. They're important.
Obviously. Yes.
Because these data are critical in order to understand, analyze, and find out various problems they face so that we can better prepare ourselves and then give them a better care.
Understood. Like the right solution.
Solution for that. And it is natural that people are concerned about their information being stolen and they don't trust digital platform or healthcare digital platforms, or they don't even trust the healthcare industry at all. But still, that is, they can't avoid being served because when they face the problems with their health, eventually they have to sort of
obviously, yes, and
take some service. So digital health actually helps them to get better service and faster. which is much more efficient than the traditional system.
Understood, yeah.
And we can talk a lot about that nowadays. The AI in healthcare is transforming the way healthcare is delivered, how things are learned, how diseases are predicted, all sort of things. So how AI is able to do all of the things, because we gathered a lot of intelligence and we gathered a lot of data, information, and we processed it. And the outcome is positive.
Very true, yeah.
Yeah.
Yes. Yeah.
So when it comes to digital healthcare, now the era of AI, and which is advancing at a rapid pace,
Yes.
and the humanity is going to benefit immensely out of it. That is for sure. Okay. In the near future, the majority of the things a physician usually does in a doctor's office are going to be replaced by AI. That is guaranteed. So, yeah.
So how does ShopDoc connect with communities to understand their unique healthcare needs?
Okay. So, ShopDoc, a lot of our marketing efforts are basically reaching our outreach programs and conducting events and seminars across local communities. We are very decentralized. We deliver our care in a very decentralized way, inspired from the Great Kerala model. And we have something called Angel program. The Angel is, in a short, I would say, an advanced version of ASHA worker. So ASHA worker is an accredited health activist, by Indian Ministry. Each ASHA worker has a particular territory where a lady goes around all the households, collect information, deliver health awareness information, materials and medicine, something like that. So we have an Angel program. The Angel for us is advanced version of a sophisticated ASHA worker. We equip that person, a lady, it is a lady, in terms of healthcare and digital health, all sort of thing. We train them and then we deploy them. So these ASHA worker or these angels for us are not like an ASHA worker, not just an advanced version, but we are creating a micro entrepreneurs, women micro entrepreneurs, and we are giving them a unit, which this unit consists of a digital clinic or lab, hospital. Each angel has to manage one of these units and a particular territory. And she can take ownership. She understands how many people in that particular village have diabetes, hypertension.
This is really fantastic.
Yeah, so this is a very grassroots level, hyper-local, decentralized model. We empower these women micro-entrepreneurs and we deploy them. And we deliver care, in a very, very sort of organic, hyper-local level.
Fantastic. So what initiatives are in place to make healthcare accessible in remote and underserved areas?
Yes. When we talk about Kerala, we have very few remote villages. We're not talking about North India where you don't have, in almost every village in India, Kerala, we have a primary health center, a physical unit. So what we are doing is we are creating a digital unit, a digital part of a primary health center, a smart virtual clinic for every panchayat town, and managed by an angel, women micro entrepreneur. So that will make sure the preventive health awareness, women's health, mental health, fitness, lifestyle disease prevention, everything, all these services are delivered on time. It's a large network of individuals offline, collaborated with local organizations, local communities, and then we integrate with our digital platform.
So, fitness for founders. What's brewing? We are all ears for this one.
Okay, so we have another community, we have another initiative, which is not new. It's been 2 years almost, or maybe more or less. So F Founders, it's called F Founders.
F Founders.
Yeah. So F Founder means fitness for founders.
Okay.
And I'm a founder. Okay. Not just founder, any creator, any business owner. We all going through a lot of challenges, not just in the professional or business, but also personal.
Okay.
Now, everyone goes through problems. And not everyone can process it, can overcome these challenges. We all need help, some sort of help. And when it comes to entrepreneurs and founders and business owner, the intensity of the problems much more, painful or eventful. And they probably wouldn't have a support system because employees look at the boss in a different way, and the communities and societies and family look at, they don't have any problems, they are in a good shape, but what these founders are going through inside. As a founder, I realized, and I know I was working in different ecosystem, and then I realized the majority of the founders I deal with also going through a lot of issues. Personal, So we started a campaign back in 2021 in collaboration in association with the Kerala Startup Mission. Fitness for founders. It's not the physical fitness, mental and emotional fitness.
I see.
So we delivered some care for some founders free of cost. And then we thought of expanding it to different cities and towns where we can help the business owners, founders, creators who are going through different problems, empower them with the right set of training in terms of fitness, wellness, the diet, nutrition, the mental health. So all in all, we call F Founders, Fitness for Founders.
Okay. So from classrooms to rural villages, how does ShopDoc play a role in healthcare, education and awareness, particularly in vulnerable communities?
Yeah, so back in 2021 or early 2022, I guess, we had something called a programming initiative, My School Clinic.
Okay.
What we aimed doing with this program, what was our purpose and what was something which we were trying really hard to achieve was reach out to almost every school in the state and create awareness in terms of and deliver lessons, preventive health, mental health, and not just the private schools, even government schools.
Government schools also.
Yeah.
Okay.
So every school can have a virtual clinic. On that clinic, we would empanel certain doctors of different specialities. If a student or teacher, even parent, want to get some support, some advice, some consultation.
So you're open to all those?
Open, yeah. So we did try, that concept, and, we want to revisit that.
Okay.
And we want to sort of implement that much more effectively.
Okay.
In the near future.
I think it's quite required these days because we can see a lot of children into video games and all those things.
Yes.
So their mental stress is entirely different. They kind of get angry and all that stuff. Yeah.
True.
So that's fantastic what you're doing there. AI and ML, the secret sauce. How are these cutting edge technologies applied in ShopDoc services and what benefits do they bring?
Yeah, well, we still haven't deployed any AI tool yet. We are working on it. We are building a AI chatbot called Mac Edge. So the thing is, now every technology is kind of embedded or instilled with some sort of AI elements to it, without which no technology would exist in the future.
Understood.
So the AI is now an integral part of every business, not just in technology, everything we do.
Everything, yeah. Even hospitality
Yes,
services and all
everything.
that.
Yes,
Yeah.
yeah. So as I saw a small company, and we past couple of months we're working with some of the AI developers, and they're creating AI chatbot to address all the questions and to process all the transactions. ShopDoc is currently offering, there are 10 different services ShopDoc offers to the patients.
Okay.
Now AI can enable those services much more efficiently, frictionless. We don't expect every patient to do this transaction by themselves, running around a website and searching for different services. AI as an agent would take care of all these needs. So this is a ShopDoc perspective, ShopDoc point of view, and gradually all the information we collected we'll use AI tool in order to analyze and even do the prediction in terms of disease and understanding deeper into it.
Yeah,
There are some great AI companies specific to healthcare, the groundbreaking discoveries they're coming up with in terms of predicting diseases beforehand. Just looking at your retina scan, this AI can tell you within how many years you're going to have a cardiovascular disease.
Oh, okay.
Everything is interconnected. So,
Super.
and radiology, I don't think there's going to be a radiologist in few years' time,
Okay.
because AI can read and interpret a scan or radiology result much more efficiently, much more accurately than a human radiologist.
Okay.
A lot of the works now a typical physician does is definitely going to be replaced by AI.
Yeah. Okay.
That is for sure.
So that's going to be the world again.
Yeah.
AI here. So building the future of healthcare in the Metaverse, share your vision for the world's first school clinic in this virtual realm.
Yeah, well, so when we launched that concept 2021, we were the first company in the world to announce that we're going to have world's first Metaverse clinic for schools.
Mm-hmm.
We developed that concept. We did try, but there were challenges. The infrastructure requirement for each school, for every child to have a headset, VR headset, not practical, to stream high amount of data, the digital connectivity not up to the mark in our part of the world.
Okay.
So a lot of infrastructure-wise challenges, and the technology was still evolving, not mature enough. So there is a future for Metaverse. We did invest our time, our money into Metaverse, building this concept. However, we have now paused that because we are focusing more on that what we already built.
Okay.
This Metaverse thing is still going to take a lot of time for the people to adopt it. So as a business, it's not sustainable for us to chase behind something which is not used by people now.
Okay, got it.
So it is not our, as a small company, it is not our headache. It's with the large companies, big, huge companies. If they could invest millions of dollars and billions of dollars into build the whole metaverse infrastructure and getting people more used to it, metaverse, and then we can sort of build something out of it. So yeah.
So it takes lots of investment to
and people need to adapt.
Yeah.
And infrastructure-wise, it's the metaverse. It's like a three-dimensional, and there are different definition for metaverse. I would say, in simple words, for people to understand, it is a three-dimensional website or three-dimensional app in which you can interact lively, with other avatars, people, communities. In the case of healthcare, you, instead of going to a physical clinic, a hospital, you would go to a virtual reality or augmented reality or mixed reality environment, three-dimensional environment. Without stepping out of your house, you would feel like you are in a hospital. You could consult with the doctors of your choice. Okay. And how the other healthcare measurements are taken. For example, to check your vitals, to capture certain information from your body, so without any touch. So one of the challenges with the metaverse is, or even in the digital health, capturing information. We need a lot of IoT devices to capture, different readings of your body, pulses, heart rate. There are, wearables now. And in the metaverse case, all these things to be integrated and bring all this information and feed into a particular unified system in which all other transaction can be done. That is going to take a little bit more time.
Okay, it's fantastic. Thank you so much for being with us today and sharing all the information that is required.
Thank you.
And I wish you all the best for your future endeavors.
Thank you.